Hey Alpha Nurses, I'm Nurse Sandro from alphanurseguy.com. This is NCLEX PN Review Lesson 14. We're going to be doing psychiatric medication questions. You can follow me on Facebook, Instagram, and TikTok to get any updates. Links will be in the description. Without the way, let's get started.
Question 1. Disulfiram is prescribed for a client seen in the psychiatric healthcare clinic. The nurse is collecting data on the client and is reinforcing instructions regarding the use of this medication. Which is most important for the nurse to determine before administration of this medication? A. A history of hyperthyroidism. B. A history of diabetes insipidus. C. When the last full meal was consumed. D. When the last alcoholic drink was consumed. The correct answer is D. When the last alcoholic drink was consumed. Rationale: disulfiram is used as an adjunct treatment for selected clients with chronic alcoholism who want to remain in a state of enforced sobriety. Clients must abstain from alcohol intake for at least 12 hours before the initial dose of the medication is administered. The most important data are to determine when the last alcoholic drink was consumed. The medication is used with caution in clients with diabetes mellitus, hypothyroidism, epilepsy, cerebral damage, nephritis, and hepatic disease. It is contraindicated in severe heart disease, psychosis, or hypersensitivity related to the medication. Question 2. The nurse is caring for a hospitalized client who has been taking clozapine for the treatment of a schizophrenic disorder. Which laboratory study prescribed for the client should the nurse specifically review to monitor for an adverse effect associated with the use of this medication? A. Platelet count. B. Cholesterol level. C. White blood cell count. D. Blood urea nitrogen level. The correct answer is C. White blood cell count. Rationale: hematological reactions can occur in the client taking clozapine, which include agranulocytosis and mild leukopenia. The white blood cell count should be checked before initiating treatment and should be monitored closely during the use of this medication. The client should also be monitored for signs indicating agranulocytosis, which may include sore throat, malaise, and fever. Options A, B, and D are unrelated to this medication. Question 3. The nurse is collecting data from a client, and the client's spouse reports that the client is taking Dempazole hydrochloride. Which disorder should the nurse suspect that this client may have based on the use of this medication? A. Dementia. B. Schizophrenia. C. Seizure disorder. D. Obsessive-compulsive disorder. The correct answer is A. Dementia. Rationale: Dempazole hydrochloride is a cholinergic agent used in the treatment of mild to moderate dementia of the Alzheimer type. It enhances cholinergic functions by increasing the concentration of acetylcholine. It slows the progression of Alzheimer's disease. This medication is not used to treat the disorders in options B, C, and D. Question 4. Floccident is prescribed for the client, and the nurse reinforces instructions to the client regarding the administration of the medication. Which statement by the client indicates an understanding about administration of the medication? A. I should take the medication with my evening meal. B. I should take the medication at noon with an antacid. C. I should take the medication in the morning when I first arise. D. I should take the medication right before bedtime with a snack. The correct answer is C. I should take the medication in the morning when I first arise. Rationale: Floccident is a selective serotonin reuptake inhibitor. It is administered in the early morning without consideration to meals. Options A, B, and D are incorrect. Question 5. A client receiving a tricyclic antidepressant arrives at the mental health clinic. Which observation indicates that the client is correctly following the medication plan? A. Reports not going to work for the past week. B. Complains of not being able to do anything anymore. C. Arrives at the clinic neat and appropriate in appearance. D. Reports sleeping 12 hours per night and 3 to 4 hours during the day. The correct answer is C. Arrives at the clinic neat and appropriate in appearance. Rationale: depressed individuals will sleep for long periods, are not able to go to work, and feel as if they cannot do anything. Once they have had some therapeutic effect from their medication, they will report resolution of many of these complaints, as well as demonstrate an improvement in their appearance. Question 6. A hospitalized client is started on phenylzine sulfate for the treatment of depression. The nurse reinforces instructions to the client and tells the client to avoid consuming which foods while taking this medication. Select all that apply. A. Figs. B. Yogurt. C. Crackers. D. Aged cheese. E. Tossed salad. F. Oatmeal cookies. The correct answers are A. Figs, B. Yogurt, and D. Aged cheese. Rationale: phenylzine sulfate is a monoamine oxidase inhibitor. The client should avoid consuming foods that are high in tyramine. Eating these foods could trigger a potentially fatal hypertensive crisis. Some foods to avoid include yogurt, aged cheeses, smoked or processed meats, red wines, and fruits such as avocados, raisins, and figs. Question 7. A client taking buspirone for 1 month returns to the clinic for a follow-up visit, which should indicate medication effectiveness. A. No rapid heartbeats or anxiety. B. No paranoid thought processes. C. No thought broadcasting or delusions. D. No reports of alcohol withdrawal symptoms. The correct answer is A. No rapid heartbeats or anxiety. Rationale: buspirone hydrochloride is not recommended for the treatment of drug or alcohol withdrawal, paranoid thought disorders, or schizophrenia. Buspirone hydrochloride is most often indicated for the treatment of anxiety and aggression. Question 8. A client taking lithium carbonate reports vomiting, abdominal pain, diarrhea, blurred vision, tinnitus, and tremors. The lithium level is checked as a part of the routine follow-up, and the level is 3.0 milliequivalents per liter. The nurse knows that this level is which? A. Toxic. B. Normal. C. Slightly above normal. D. Excessively below normal. The correct answer is A. Toxic. Rationale: the therapeutic serum level of lithium is 0.6 to 1.2 milliequivalents per liter. A level of 3 milliequivalents per liter indicates toxicity.
That's all I have for this video. Please like, share, let me know if you have any questions. If not, I'll see you in the next video. Thanks for watching.